Guys, welcome back to Medical Coding with Blue. As promised, a lot of these are procedures for urology. Okay, so let's get started. Now, I did throw in a couple of things to try to trip you guys up. So if you have any questions over the weekend, it's totally fine. You can go ahead and email me. I will be including my email address down in the description box below. We will be discussing the answers on Answer Monday. As always, I will include the questions down in the description box. So let's go ahead and get started. Oh, and these questions are not official. These exercises are totally not official. This is just me as a veteran medical coder, just sharing what I know. All right, let's get started. Number 1, the patient is 6 months, status post C6 through C7 ACDF. The patient has healed nicely and can return as needed. Number 2, the patient has a malignant neoplasm of the right kidney. They had a renal biopsy done percutaneous by trocar. Okay. Number 3, the patient has congenital ureterocele orthotopic. A ureteroplasty was performed. Number 4, the same patient in this previous scenario is following up 6 weeks status post-surgery. What is the aftercare and the procedure code? Or procedure codes? Okay, number 5, a laparoscopic ureterolithotomy was performed for the patient's calculus of the ureter. Number 6, the patient has a bladder stone. A cystolithotomy was for removal of the stone was performed without vesical neck resection. Okay. Number 7, the patient has tuberculosis of the prostate. An incisional biopsy was performed on the prostate. Number 8, the patient has a congenital prolapse of the urethra. A plastic repair of ureterocele was performed. Number 9, a vesiculotomy. I hope I said that right. Vesiculotomy was performed for hematospermia. I always get that word confused. I get tongue-tied. Okay, and number 10. This is just the diagnosis code on number 10. Rhinosinusitis that is chronic and hyperplastic. Okay? So those are your questions for Quiz Friday. I will be discussing the answers, like I said, on Answer Monday. And again, if you guys have any questions, let me know. And I know this one is really short, but I did take some notes for more urology, so I think I'm going to do another follow-up on urology Q&A. I sort of like that idea of like going specifically by each specialty and sort of doing a Q&A on those. So if you are a specialty coder, or if you are brand new to medical coding and you have a particular question about a particular specialty, just let me know and I can go ahead and try to work on something like that as well. And I know I'm going to be working on some more of the E&M stuff this weekend, because I did promise you guys that I was going to do that. And the time before Chicago, I literally thought I had more time to do stuff before I left for Chicago. I did not. So it reflected a lot because I missed a couple of days in filming. And I hate missing days in filming because I feel like I just kind of want to stay on that, like, I film Monday through Friday, and I try to make sure I catch up with you guys and respond to your emails as quickly as I can. So unless you send me an email during the day, it's hit and miss sometimes with my email, and sometimes I'll take my phone outside, like on my lunch break or whatever, and check and see if I have any emails. So if you don't hear from me right away during the day, that's probably why. So anyway, I will go ahead and close this up. I hope you guys have a great weekend, and I will see y'all on Monday. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. All right, I will see y'all on Monday. Bye.